Hi everyone, my name is Kate O'Connor, a graduate student at the School of Public Health, University of California at Berkeley. Today I will be presenting an emergency management disaster recovery plan for a Black Swan incident at the Kapi'olani Medical Center for Women and Children, Hawaii. A Black Swan incident is a metaphor for an unexpected and rare phenomenon, an incident of low probability of occurrence but of extreme impact, an outlier of unusual expectations. Ultimately, one cannot completely predict or understand a black swan incident. However, protective measures should be taken to avoid and mitigate the negative consequences of a lack of preparation, lack of knowledge, and lack of understanding in the face of an unexpected but possibly devastating outlier, the unthinkable, a terrorist attack in the Children's Hospital. Two recent black swan incidents are the terrorist attack of 9/11 and one of the greatest and longest healthcare emergencies of our history, COVID-19. The Black Swan incident I am presenting is a terrorist attack with a radiological dispersal device detonating in the Pediatric Intensive Care Unit of the Children's Hospital. Kapi'olani Medical Center for Women and Children is the only full-service pediatric hospital with the only full-service pediatric intensive care unit for the entire state of Hawaii and the entire South Pacific region from Samoa to Saipan. The loss of services of this hospital would be devastating to the island. It would mean loss of labor and delivery services and loss of all the specialty and intensive care services for the children of Hawaii. Hawaii is a paradise to many, but it can be a safe haven to terrorists. Hawaii has many remote areas that terrorists can hide and plan their nefarious actions away from the prying eyes of law enforcement. There are also people on the island that are against the U.S. government and would sympathize with terrorists. This is the reason that FEMA and the emergency management agencies of Hawaii suggest that it's important since 9/11 that hospitals need to plan for the unthinkable, a terrorist attack on the Children's Hospital. I'm a pediatric critical care nurse practitioner who has run the pediatric intensive care unit for years, and I am aware how wonderful prepared we are to weather all the many natural disasters that is visited upon Hawaii, and we have done well since we've opened the doors of the Children's Hospital in 1890. But I'm also woefully aware that we are unprepared for a terrorist attack. It is a revered and loved and deeply respected institution, one that deserves the protection of the best possible emergency preparedness plan against the black swan incidents of a terrorist attack, a dirty bomb. So what would be the result of a detonation of an RDD in the PICU? This would cause dissemination, aerosolization, and propelling of radioactive material, contaminating and exposing all of the children, all of the staff, and all of the families. Because of the explosion would blow out windows, this would also be spreading out into the community. The health impacts of radiation contamination could be affecting the population's health for years to come. A radiological dispersal device is a weapon of mass disruption. It will disrupt the normal activities of the community. This is the objective of the terrorists, to disrupt our way of life. Because of the mass casualty incidents, it will overwhelm our local resources, our hospital resources, and we will have to call upon our state and federal partners for a collaborative response in order to safely triage, decontaminate, treat, and transport our patients to safety. It is very likely that the hospital's resources will be completely overwhelmed by this terrorist attack, and we will quickly need to reach out for our local support teams and likely reach out to our national and our federal partners in order to meet the challenge of this terrorist attack. The hospital response to this emergency will be guided by our concept of operations plan. The first 100 minutes and the first 100 hours after a bomb detonation in the pediatric intensive care unit are crucial. Response efforts must be immediate, targeted, well thought out, well planned, and well executed in order to respond and rescue the most lives, mitigate the most disaster, and keep the most people safe. This is a time of great confusion and chaos because of the fear and trepidation about radiological contamination and possible biological terrorist agents as well, smallpox and anthrax. The blast injuries itself will cause mass casualty that will quickly overwhelm our hospital response and likely our local emergency support services, and we'll be immediately moving to alert our state and federal partners to match resources with us and move to safely triaging, decontaminating, transferring our pediatric patients out to our receiving hospitals, as well as evacuating safely the hospital, keeping the surrounding community safe. After those actions have been completed, we will then enter into a critical evaluation of our response. How well did we meet the challenge? How many lives were we able to protect and save? In order to face critical emergencies in the hospital and to protect patients and staff's health and well-being, the incident command system has been adapted into medical practice so that we can streamline our communications and have delineated roles that will quickly facilitate decision-making. We also need to be able to expand our incident command in order to accommodate multi-agent support. With a mass casualty incident with a radiological dispersal device, we are going to need support for surge care, decontamination, field hospital setup, as well as fatality management, damage assessment, transfer of all of our patients safely to receiving hospitals, laboratory services, as well as radiation level assessment. We're going to be able to have an incident command system that is able to expand in order to accommodate all of our multi-agencies and then to downsize as we move our efforts to recovery. As you can see, our hospital incident command org chart can expand to accommodate our multi-agent support services, such as the incident consultant for a radiological dispersal device, our fatality management, our expanded medical services with DMATs, and our decontamination consultant units. Beyond the initial rescue phase, a short-term recovery plan will be put in place to restore and integrate all of the services necessary to return the community back to its quality of life and maintain its health and well-being. Basic needs of food, water, and shelter will be restored. There will be ongoing, clear, and consistent, accurate public information regarding the disaster and community safety, ongoing crisis counseling, ongoing human services, safety and security will be continued, and restoring of all of the pediatric services. Capital Medical Center for Women and Children will be working with all of the local hospitals that were receiving hospitals and returning all of our services back to their baseline. The short-term recovery plan will also include opening up the airports at all of the surrounding structures and businesses close to the hospital, as well as safe removal of all of the radiological contaminated items. In order to meet this challenge, there will be comprehensive and targeted education for all of the staff of the hospital. High-level education and training on a biannual basis will be mandatory and will be delivered as online educational programs that are accessible 24/7, as well as for the clinical staff, there will be high-fidelity simulation training. The comprehensive clinical training will be available to all of the hospital staff, targeted directly to what their roles are. So there will be clinical and acute care staff, as well as general physician staff, ancillary staff, and as well the leadership staff. The most important aspect of the plan was the coordination of multi-agency supports and being able to collaboratively and cooperatively work with these agencies. One of the most important aspects of the plan was the communication plan, making sure that the hospital had control and maintained both internal and external communications, delivering accurate, concise, consistent, science-based information to staff and patients and the population at large. Another important aspect of the plan we would want to include would be additional provisions for emphasis on mental health support for families and staff and patients. For the protection of those who are the most vulnerable, the sick and hospitalized children of Hawaii, a well-developed and well-practiced emergency management preparedness and disaster plan in the face of a terrorist attack is critical. We will be ready.